truly exciting news, of course. Our presenter today, Dr. Amit Garg, who worked on his bachelor's degree in a combination of biology and mathematics from the University of Western Ontario in 1991, followed by an MD degree in medicine from the University of Toronto in 1995, and then internship and residency and chief residency at McMaster University in 1998. Clearly a guy who gets around Ontario. A master's degree in medical education from McMaster University in 1998, and then a PhD in epidemiology and biostatistics, also from the McMaster in the year 2005. He's currently an associate professor in the Department of Medicine at the University of Western Ontario. He's an adjunct scientist here at ISIT. He's the director of the London Kidney Clinical Research Unit, as well as a staff nephrologist at the London Health Sciences Center. Lots and lots of accomplishments. I was particularly impressed by his CIHR Clinician Scientist Award, multiple prizes for academic excellence. He's got over 100 Medline articles to his name. He's the PI on several active CIHR grants, and he's also a former high school valedictorian.
Well, thank you very much for that kind introduction. It's a real pleasure being back here. Actually, I did my first medical school clerkship, not even clerkship, student interviews here at Sunnybrook in the early 90s. And I recall very fondly that actually one of the first clinical skills things I saw was a vascular access in a dialysis patient. And so obviously that was a very formative experience for me. I ended up going on to become a nephrologist. So it's a real pleasure to be here. And in terms of the talk that I have today, it's something a little bit different. It's actually about information retrieval, not a typical, perhaps, ISIS project. And on behalf of my colleagues at McMaster, and particularly the Health Information Research Unit there, where Ann McKibben, Brian Haynes, and Nancy Wachinski are there, and along with colleagues and students and staff in London, really glad to be here, and I hope to share some of these results that you'll find interesting about infodialysis. So it's a bright new day, coffee in hand, you head into the dialysis unit to do rounds, and then you have a meeting. So like all good nephrologists, you deal with low hemoglobin with your left hand and high phosphates with your right hand, and you whip through the unit, you sit down, and the team is reviewing the protocol for hepatitis B vaccine in the dialysis unit. And unfortunately, the response rate has been quite low.
That's amongst patients or staff?
Amongst patients. And so one of the dialysis nurses quite astutely asks you, would it be better if we gave our vaccine intradermally rather than intramuscularly? And then they look to you to give advice on this issue. So you're sitting there thinking about it, and to be honest, you have no clue what the answer is. So you say, well, that's a very good question. I really want to make sure I give you the best answer possible. I'll review the issues and get right back to you. So you quickly go to your office, set on the internet, and one of the things we commonly do as physicians is go to something called UpToDate. It's one of these programs that's pretty common now in many environments, including ours in the London Health Sciences Center. So you quickly do an UpToDate search around this issue, and it's really not that helpful. It just says that people have tried to modulate the immune response by changing the mode of injection, but doesn't tell you whether it's beneficial or not. So then you go to PubMed, and you type in your search, hepatitis B vaccine and chronic kidney disease. And what it turns out happens is you get 137 articles back after you do your search. And just like all Medline searches that we do, there's a lot of junk in that search. And so actually, when you actually go through these 137 citations, you find 6 articles are relevant for the question you were trying to answer. So 6 out of 137, or in other words, 23 junk articles for every one good article. So then that gets you thinking some more. is there any way I could have retrieved less junk? I'm busy, I have so many things to do. Could have this been done more efficiently? And also, you always wonder in the back of your mind, is there important information that I missed in my search? And it turns out that actually someone has done a systematic review on this very topic. And as a part of a good systematic review, they scour the world's literature to try to identify articles that are relevant for the question you were asking. And it turns out there are 12 controlled trials on this issue, of which 11 are in PubMed. So just to emphasize, your search found 6 of the 11 relevant articles, and you missed 5 articles. So in terms of things I wanted to discuss today is challenges of PubMed searching, this concept of search filters, come back to this hepatitis B search you just did, and then consider whether these search filters can improve physician searching.